So I got together with all of these other people as my advisors, and there's several other advisors that are not on this slide. And I've been talking to people as I've been crossing the country. First, when I was at Cortigen for genetic testing, and now in Spectrum Needs and in my private practice and in the telemedicine practice that I have. And I've spoken to hundreds of different doctors that take care of patients with neurodevelopmental disorders, including ADHD, and designed a supplement which has 33 different components to it, but includes a very high-powered mitochondrial cocktail to it. So it's similar to the Adams and the Kaplan formula, but it has a higher powered mitochondrial component than what the ones that they studied. It has activated vitamins. The formulation has been made by a lot of people, including all of these. It corrects dietary deficiency, and it's made in the United States with good manufacturing practice. Comes in 2 flavors. Here's a label that shows you what the 33 ingredients are. It includes everything except for the fatty acids, the essential fatty acids that we've spoken about so far. So this formula is supposed to be complete except for the essential fatty acids. And then the amount that you give depends upon the weight of the child. And this is on the label, and it's also on the website. But I found that the CoQ is not enough. CoQ comes in 2 different forms, ubiquinone and ubiquinol. And the difference is in the last letters. Ubiquinol is the good one and has the L at the end. There's ubiquinone, the other one in Spectrum Needs, because it's a powder and you can't put ubiquinol, which is an oil. It doesn't work in the powder. So I found that I needed to supplement additional ubiquinol form of CoQ, not ubiquinone, in my patients because their CoQ levels weren't high enough and the benefit wasn't where I wanted it to be. So I was using other brands of CoQ, but it became problematic because many of these brands, you have to either go into the store to get the lower price brands, or many of them had soy in it. In fact, most of them did. So we came up with our own brand that's Q Needs, which is very similar to what I used to use. It's a tiny little gel capsule. It has limonene in it, which is the oil of a lemon peel instead of soy oil. And the bioavailability is great. My patients, their blood levels have gone up quite high. And in many cases, I could even cut back on the amount of CoQ. So I do recommend a ubiquinol on top of Spectrum Needs, because otherwise you just won't get the CoQ levels in there and you just won't get the type of improvement. You won't get the full improvement.